Welcome to this video guide on psychiatric medications. We will explore how they work, who they are for, and the factors prescribers consider. Please note that this is a general informational overview and not medical advice. In this video, we will cover the basics of brain chemistry, explore different classes of medication, from antidepressants to mood stabilizers, and discuss how a prescriber decides on the right treatment plan for an individual. Why are there so many kinds of medication? Because your brain uses multiple chemical messengers, such as serotonin, dopamine, norepinephrine, and GABA. Each medication family is designed to influence these specific messengers differently. Messages in the brain travel across a gap called a synapse. This involves the release of a chemical messenger, it landing on a receptor, and finally a cleanup process. Medications typically target one of these three steps to manage symptoms. Here is a quick cheat sheet for the 7 medication families we will discuss, outlining their main jobs and how quickly they generally take effect. Antidepressants are often described as mood lifters. Rather than providing an instant boost, they work by slowly adjusting the levels of brain chemicals like serotonin, much like turning a thermostat up gradually. There are 4 primary subfamilies of antidepressants: SSRIs, which are commonly prescribed, SNRIs, the older generation known as tricyclics, and MAOIs, which are typically reserved for more difficult cases. Starting an antidepressant is a process. The first few weeks may involve side effects before benefits are felt. By week 6 to 8, the full effect is usually evident. While best known for treating major depression, antidepressants are also commonly used for various anxiety disorders, OCD, and even chronic pain or migraines. Anti-anxiety medications act as the brain's brake pedal, calming overactive systems. These medications range from fast-acting benzodiazepines to slower, steady options like buspirone. Benzodiazepines provide fast relief but require careful management. Because of the risk of tolerance and withdrawal, they are typically intended for short-term use during acute spikes in anxiety. When managing conditions like panic, a combined approach is often used: daily medication for baseline anxiety, fast-acting medication for acute moments, and non-medication tools like therapy and breathing techniques. Mood stabilizers are the levelers, primarily used for bipolar disorder. They act like a tightrope walker's balance pole, helping to smooth out extreme mood swings into more manageable waves. For medications like lithium, regular blood tests are necessary to ensure the dosage remains in the safe, effective range. This monitoring is a standard and manageable part of the treatment process. Mood stabilizers are effective because they address both the manic and depressive ends of the spectrum, offering a balanced approach that helps prevent shifting from one extreme to the other. Antipsychotics are the reality tuners of the brain. They help filter and organize sensory and thought signals, easing symptoms like hallucinations or delusions, much like lowering the static on a fuzzy radio signal. Antipsychotics are divided into 2 generations. Typical antipsychotics from the 1950s are effective, but carry higher risks for movement-related side effects. Atypical antipsychotics, introduced in the 1990s, have a different side effect profile, including metabolic impacts. Clinicians monitor 2 symptom types: positive, which are added experiences like hallucinations, and negative, which are reductions in normal functioning. Antipsychotics reliably target positive symptoms, while negative symptoms often require therapy and rehabilitation support. Stimulants serve as a focus dial for the brain. Most often used for ADHD, they sharpen attention and reduce impulsivity. There are 2 main families: methylphenidate-based and amphetamine-based medications, both of which require medical monitoring. Stimulants don't just speed up the brain. They boost underactive attention control circuits, which often results in a calming, organized effect. Non-stimulant options also exist for those who need them, and all treatments are highly individualized. Sleep medications serve as an off switch, providing short-term relief for insomnia. Categories include Z-drugs, melatonin receptor agonists, and certain sedating antidepressants used off-label, all working to guide the brain towards sleep. Because the body can adapt to sleep aids, they are meant for short-term use. Prescribers typically pair them with sleep hygiene habits, cognitive behavioral therapy for insomnia, and efforts to address the root cause of the sleep disruption. Psychiatrists choose medications based on an educated process, considering symptoms, past responses, potential side effects, other health conditions, and personal or family medical history. There is no single blood test for these decisions. Finding the right fit is a journey, as over 70% of patients don't fully respond to their first antidepressant. Adjusting treatment is standard practice and may involve changing doses, switching medications, or adding therapy. A typical first visit involves gathering your medical history, discussing a diagnosis, making a shared decision about treatment, and setting a clear follow-up plan. This roadmap helps ensure you are supported throughout the process. When one medication isn't enough, prescribers may combine treatments. This can include augmentation to boost effect, treating co-occurring conditions like depression and ADHD simultaneously, or adding a second medication to manage side effects. It is important to address common myths. Psychiatric drugs do not produce a high, they are not for the weak, and they don't always work immediately. These are medical treatments meant to restore normal function. Side effects should be categorized as common and manageable, worth a call to your prescriber, or an emergency. Your healthcare team is there to help you distinguish between these categories and manage your care safely. Medication is rarely a standalone solution. Combining it with therapy, healthy lifestyle choices, and regular check-ins often yields the best outcomes. Research consistently supports this comprehensive approach to mental health. Finally, always stop medication under guidance. Sudden withdrawal can cause uncomfortable symptoms or rebound effects. A physician-guided taper ensures you can safely navigate the process of ending or changing your treatment. In summary, there is no single psych pill. Think of it as a toolkit instead. Each family of medication targets specific brain processes, and your prescriber's role is to select and adjust the right tools for your unique needs over time. This video provided an educational overview of psychiatric medications. For further reading, you can refer to the sources listed on screen, including the National Institute of Mental Health and various clinical resources. Always consult a licensed prescriber for personalized medical decisions.